Hi guys, it's Dr. Denney over at Four Paws at Fulshear Veterinary Clinic, and today Maddie and I are going to be answering a few more questions you may have on, well, what do I do if my dog does get diagnosed with cancer? This is a hard topic for many. There are a lot of clients that have been through this. I myself have had a cancer scare with one of my pets, so this is a topic that's very near to my heart, and I know it's very difficult. So I hope that these videos help alleviate some of the stress, answer some questions that you might have, and if you do still have questions or concerns, please reach out and make an appointment and we can sit down and chat in person because this is very hard to go through.
Dr. Denney, what happens after a dog is diagnosed with cancer?
So once we have a diagnosis, and let's talk a little bit about what that means. What is a diagnosis, okay? That not only says that, okay, we know that the pet has cancer, but then we also know what kind it is. So we can have cases where we're looking at something, or we have a mass or a bone tumor or something we can see on x-rays and say, okay, this is cancer, and then we kind of have to figure out, okay, well, what kind is it? What's the most likely kind of cancer? Because oftentimes, just based on some of our diagnostic imaging, I can tell you like, hey, these are the top 3 types of cancers. I'm 98% sure this is one of them, and we'll talk about, do we want to get into biopsies? Some clients will, some clients won't. But when we have a presumptive diagnosis of cancer, we will talk about, okay, well, what if we don't know the specific type yet, then we'll talk about what are the most common kinds, and of those most common kinds, how do they act? What's the timeline? Do they spread? What are symptoms? And we go into kind of, well, what are our options from here? So kind of segueing from that, let's get into, okay, we'll say we know exactly what kind of cancer it is, we have a biopsy confirming, and now we're like, well, now what? Okay. I typically will start doing cancer staging. So that's the next step, just like in humans. So we're trying to see, okay, has it spread somewhere? Just like breast cancer can get to stage 4 where it's gone elsewhere in multiple places in the body, so can different types of cancers in dogs. So we will talk about an abdominal ultrasound if we haven't done one already. We will talk about chest x-rays looking for metastasis to the chest or tumors that have spread to the chest, because that does impact survival time and possible treatment. And if an owner decides to pursue treatment. If there's evidence of stage 4 cancer and it's everywhere, like if I do an ultrasound and every organ has been invaded with cancer and there's lung tumors too, and the dog feels very badly, we may not pursue treatment. We may choose to make a harder decision and maybe consider to humanely euthanize and say goodbye. So that's a conversation that needs to be had with your veterinarian, or if I'm your veterinarian, with me, and we go through that. It's going to be individual for every pet. Not every pet is the same. Not every cancer is the same. If we get a skin tumor that comes back as a mast cell tumor, we'll probably do some meds first to try to shrink it down, and then if I'm able to, I'm gonna surgeries that sucker off. And we'll try to get like a cure, so surgery can be an option. If my clients are interested in a full workup, once I've done as much as I can do, then I can always put a referral into veterinary oncology. So we refer to Sugar Land Veterinary Specialty Hospital quite frequently, along with Gulf Coast and Texas A&M Veterinary School, the teaching hospitals. So those are like 3 places that you can refer to, and I know there's another oncology that just opened up in Pearland. But oncology consults are an option because they're going to have more information, because that is all they do. They deal with cancer. It's kind of like if you go to a dermatologist and you get diagnosed with melanoma, like the dermatologist is going to send you to a surgeon who's going to send you to an oncologist. Like, and your oncologist is going to answer all these questions. I've got a very broad understanding of everything. Veterinarians do everything, like general practitioner veterinarians, we do a little bit of everything. So I will be able, with my knowledge base, to walk you through those steps, and then if we decide to pursue tertiary care / a referral with oncology, then I can facilitate that.
What is the cure rate of dogs with cancer?
So just like I was saying earlier, it depends on what type of cancer it is, okay? A small skin tumor that's a mast cell tumor, surgery has a high likelihood of being 100% curative. An anal gland tumor that has metastasized or spread to other lymph nodes in the body, with radiation and chemo, like it can buy you time, but ultimately the pet will succumb to their disease. So it's going to be very dog specific, like per patient specific. Like there's not a broad statement that I can say that says, oh, if you have this type of cancer, the cure rate is this, your dog will live X amount of days, and this is when we can expect the cancer to get really bad and when we have to say goodbye. That's not how it works. Every patient is different. We have to evaluate each patient. We have to evaluate where the owners are at. Are the owners able to financially afford treatment, or are we not? And do we go straight to quality of life and trying to maintain quality of life and pain control, like hospice care? So it's really individual per pet. This is a conversation that I'm having with a phone right now, but this is a conversation that really needs to be had in an exam room, in person, or on a phone. And we go through what's individually going on with your personal pet, and we talk about those options. I feel it's really impersonal to be talking to a phone about this, because this kind of stuff is really hard, and it's really emotional because our pets are part of our families. So when we're having these conversations, I prefer for them to be in the clinic. I hope this gives you like a good foundation. But please, like if we are considering going through this, please make an appointment, or if we haven't already, like call me and let's do a phone consult and let's kind of walk through this together. So I think Maddie maybe has one more question for me.
Is a dog cancer diagnosis a death sentence?
So once again, I'm gonna refer back to what we were just talking about. Every cancer is different. Some cancers are more curable than others. Certainly stage 4 tumors everywhere in the body. If the patient feels awful, that patient is typically not going to live for very long, and we may make the decision to say goodbye a little bit sooner. I always say that we have to love them enough to let them go. In my experience, our animals give us so much love, unconditional love. Like even when I'm pissed off with my husband, my cat is right there for me. My cat doesn't make me mad. He doesn't, he might do something dumb and break something, but it's not like an emotional thing. Like my animals are always there for me. And so I believe, for me personally, this is going to vary different for every client or person, but I believe that it's my job to make sure that my animals don't suffer, ever. Even if it's a part where my heart desperately isn't ready to let go, but my head knows that it's the right thing to do. And I will be crossing that bridge probably shortly with my cat. And, getting emotional just talking about it, which I'm sure if you're watching this video, you're feeling it, you know what this feels like. This, knowing that it may be time to say goodbye and wrestling with that. And that's normal. But I'm here to have these conversations with you. We're here, my team here is here to support you through this. It's really hard. No one likes cancer. Cancer's horrible. And I hope this helped answer some questions. Thanks, guys.